Hey, I almost said it's Friday, but it's not. It's Thursday. I am inviting my guests. If you're joining, I am here to host the last Ready to Pop installment, hosted and brought to you by Tommee Tippee ZA. And my last guest is Dr. Kofi Kwaw-Asante from Gynae Works. I'm just trying to get him online. Okay, it's showing now. Invite. Just some fun facts. If you, like me, are from Ghana or know anything about Ghana, Kofi is actually a name that's given to you if you're born on a Friday. I know this has nothing to do with the topic, but I'm waiting for him to join, so I thought I'd just mention that. So let's see if he actually was born on a Friday. Hi, everybody. Good evening. Hello, hello, hello. Hey, hey. It's a Thursday. So I'm just waiting for Dr. Kofi Kwaw to join us. There we go. He's joined. I hope he's seen my invitation. Let's see. It might, I might need to re-invite him. Just give me one moment. Let me check. Yeah, I don't know why it does that. So apparently you have to wait for the person to actually join the call beforehand. Okay. Can everybody hear me? Oh, it says he's unable to join. One moment. Let me try again. Please, Instagram Live, don't do this to me. Not today. Okay, invited again. Let's see if that works this time. Hi, everybody. Oh, there we go. Third time lucky. Hi, Dr. Kofi. How are you?
Hello. Fine. How are you?
I'm good, thank you. Can you hear me?
I can hear you perfectly. Can you hear me?
Yes, I can hear you perfectly as well. Thank you so much.
Yes.
I'm not sure if you saw what I just said, but I'll go right from the top. Okay, so welcome to everybody who's joined us on the Tommee Tippee page. We're here for the last installment of the Ready to Pop series brought to you by Tommee Tippee ZA. And I'm Jennifer Bala, your host. I'm also a proud mom of 3 beautiful daughters, wife to musician Luisa Bala. And yeah, but it's not about me as always. It's about my guest. And Dr. Kofi, I was just telling everybody, because you know I'm half Ghanaian and obviously you're originally from Ghana.
Yes.
Although I don't know the background, I was just buying time trying to invite you and telling them that in Ghana, if you were called Kofi, that means you should be born on a Friday. But I'm not sure if you're actually born on a Friday.
I was actually born on a Friday, eh?
Oh, you were? Okay. So,
Yes.
so they
Yes.
stuck to your name. Okay, that's good to know.
Yeah.
Okay.
So
So we have an interesting evening ahead of us. This whole week we've been obviously speaking to different guests. We spoke to Dr. Nadia Harris about exercising in pregnancy from Yoga Mamas A. We also spoke to Maggie Muller. Sorry, I'm not Afrikaans, so it's a bit tricky for me. But she's a twin mama who's a certified doula. Obviously went through quite an ordeal with her twins.
Yeah.
We also spoke to Lynn Bluff from Expectant Mother's Guide and a whole host of other organizations, and she really helps a lot with breastfeeding and all the support that goes around it. And I'm mentioning them because in each of these episodes we were giving away your book at the end, 3 copies of your book to winners, and the book is Pregnancy Related. Okay, so guys, this is Dr. Kofi Kwaw-Asante. Okay, the guy who was giving away all those books to all our beautiful winners. If you get a chance to stick around to the end of this discussion, you will again get a chance to win one of 3 copies by Dr. Kofi. So please don't go anywhere. The winners will be announced in the caption as always. Dr. Kofi, mommy brain does not allow me to memorize a lot of things. So I just want people to know just how qualified you are, please. So can I please just read a little summary about your from your resume, so to speak?
Of course, go ahead.
Dr. Kofi Kwaw-Asante is a passionate specialist obstetrician and gynecologist and founder of Gynae Works, a dedicated health center service offering premium, trusted, and 5-star rated healthcare to women of all ages. He is also the author of Pregnancy Related, a woman's health-centered narrative, a book purposefully written to accompany expectant mothers on the wonderful journey that is pregnancy. As a fellow of the College of Obstetricians and Gynaes of South Africa, Dr. Asante holds a master's qualification in obstetrics and gynecology and is registered with the Health Professions Council of South Africa. And obviously you have a very special interest in pregnancy and everything surrounding that. So let's get right into it.
Yes.
Please, before we start, everybody always hears OB-GYN. I hope I said it right. It's the acronym.
Yes.
Please, can you explain what that actually means in layman's terms?
In layman's terms, okay. So OB-GYN basically means obstetrics and gynecologist, or obstetrician and gynecologist. So obstetrician basically means a medical specialist who deals with pregnancy and pregnant women and also handles deliveries and any complications that may arise as a result thereof. So it's basically a mommy doctor. Any woman that's pregnant can see an obstetrician to manage them in the delivery, or in their antenatal care and in their delivery. Whereas gynecology refers particularly to the study, well, to women's health. It's the science and the study of women and any medical conditions or any conditions that relate to the sexual and the reproductive health of women in general. So a gynecologist would handle women that are not pregnant but have any issues as far as reproduction or their sexual health is concerned.
Okay.
Yeah.
So, but there are definitely some blurred lines there, right? Because,
Yes.
I mean, by default, because of the nature of the job. Okay.
Yes.
Obviously, today we're talking about, today we're talking about what I call birthing options, because, you know, but there are birth plans, but then there also is something called a birth plan within that. So I don't want to confuse the two, because that's how I got confused a bit earlier today. So birthing options for women, right? In terms of what kind of birth do I want? Do I want to go natural? Do I want to do a water birth, XYZ? Please, could you elaborate on that?
So with regard to birthing options, essentially you've got two main types of birthing options. So obviously you've got the natural vaginal deliveries, and then you've got cesarean section. And then further, with natural vaginal deliveries, you can classify it into what's it? So it's natural deliveries. You can classify it into people who want water births, people who want basically unmedicated births, where we're talking about the Lamaze type of births. And you can also further classify it into people who want, for example, a vaginal birth after a C-section. So
a VBAC.
A VBAC, yeah, vaginal birth after a C-section. So you've got C-sections and you've got normal deliveries, and you've got these subcategories under normal deliveries that you can further go into, depending on the nature of the pregnancy and other issues related to it.
I'm very well aware of these options since I have 3 kids. And just as a personal anecdote, I tried for a water birth with my first child almost 9 years ago. 26 hours of labor later, no pain meds. Yeah, I had to have a cesarean in the end. Oh, by the way, in a heat wave, I might add. So please don't take that away from me. And then with the second one, I by default had to have a C-section, because at the time, that is the pregnancy I had, where they weren't sure. They thought I might have a brain tumor, because I had what they called, is it idiopathic intracranial hypertension? But it was just a symptom at the time. So, so I didn't actually have it, but it was presenting itself as such, because I had a lot of pressure in my brain from spinal fluid, and I had to have lumbar punctures to drain that. And then the third time, obviously, given the history, although I was in a much better position, it was like, no. And then during a pandemic, it was like, no, we're having a C-section. So I tried my best, but, you know, it doesn't always work out, you know. And listen, it's harder to, from my perspective, it's actually much harder to have a C-section. And we'll get into that in a bit.
No, you did well though, hey?
Thank you.
Yes.
So, so tell me something. So obviously, in terms of how would one go about deciding what option to go with?
So obviously, ideally, when you fall pregnant, it would be ideal to enlist the help or the services of a healthcare worker. So a healthcare worker can be in the form of a gynecologist, or it can be in the form of a trained midwife. And then obviously they would guide you through each of the trimesters throughout the pregnancy, and ultimately assist you with delivery. And then obviously throughout the pregnancy, they would basically classify your pregnancy as either being a high risk or a low risk. And then based on whether it's a high risk or low risk, then they'll also make suggestions as to what they feel that your method of delivery should be. But there's always a number of factors that are usually determined throughout the pregnancy journey that affect how you're ultimately going to deliver. But once you enlist the services of a healthcare, whether it's a gynecologist or a midwife, then they should be able to guide you appropriately as to what's the best method, or rather not the best, the safest method for your delivery should be. Yeah.
So you mentioned midwives. So I actually had a midwife for my first one, seeing as I was also trying to do a water birth. Do you work closely with midwives? You do?
Yes,
okay.
yes.
Is that more
yes, so we have to work closely with midwives. You get midwives who as a separate entity on their own, so they run their own practices. And then in hospitals, more commonly, you get midwives that assist obstetricians and gynecologists, well, mostly obstetricians, with deliveries and the management of women in labor. So it depends, you know, from what angle you're looking at the midwife definition, whether it's in a private setting where they run their own practice, or whether it's in conjunction with an ob-gyn.
Okay. And speaking of, obviously, factors that you have to consider, I myself was an older mom, so to speak, and I know the medical term is elderly primigravida. So sounds very scary. And I was like, there's nothing elderly about me. But anyway, for us older moms, okay, because I had my first child when I was 36, okay. For those who are wondering, I am 44 and I turned 44 4 days before my 7-month-old was born. So I'm on my way to 45 soon. Thanks. So it's not easy. I mean, obviously now I have to do extra scans and extra this and extra that. And I mean, between my kids already, there were new extra things that had to be done that weren't there before, you know, and people won't touch it unless you have those extra scans. And they're quite costly, I might add, and medical aid does not cover for all of these things.
That is correct,
but anyway,
yes.
yeah, so it's quite hectic. Do you have any advice for older moms? Like, a lot of people obviously now schedule C-sections without necessarily even considering what their options are. Like, is that okay? You know what I mean? I know it's a personal choice, but in general, like...
Look, it's becoming common practice. And the reason why it's becoming common practice is we've got a lot of media available. We've got Google, you've got YouTube, you've got videos that people can watch and see what actually happens during these two types of labor deliveries. And you'll find that the two common reasons that people give for wanting a C-section, this is where it's not medically indicated. It's mainly because, number one, they're scared of the pain. And number two, they want, in terms of timing, they want things done at a certain time. On this day, I know that I'm having my baby. So they like they don't like the unpredictability of what a normal delivery would offer. And it is becoming more common practice. So people are becoming more planners, if you would. And as a result of that, yes, people do request more C-sections these days than normal deliveries. But to get to your question about the elderly primigravida, the best thing you can do as an elderly primigravida is try to plan as much as possible. So obviously, the older you get, it's going to be much more harder to conceive, first of all. So it's something that you have to give a lot of thought to. You'd have to probably see your gynae beforehand to firstly optimize any pre-existing medical conditions that you may have. Because whatever medical conditions that you have pre-pregnancy, it most certainly probably will get aggravated or exacerbated once you are pregnant. So the best pre-pregnancy, so the best is to get a good pre-pregnancy control of the medical condition, so that when you're in pregnancy, it's easier to actually manage it further. But aside from the struggle to actually conceive as an elderly primigravida, once you do conceive, there's more risks associated with the pregnancy. Automatically, like I mentioned earlier, we have to classify how your pregnancy is, whether it's a low risk or a high risk. And automatically, by being an elderly primigravida, we already classify you as a high risk patient, simply because the elderly primigravida are more prone to miscarriages. They're more prone to early preterm births. They're more prone to, more importantly, abnormalities in the baby. So congenital abnormalities like Down syndrome are also a thing of elderly primigravidas. And then also conditions like gestational diabetes and hypertension, preeclampsia, more common in the elderly primigravida than in your younger pregnant patients. But all of these can be managed, provided you've got a good healthcare team who know about your pre-existing medical conditions, can optimize them before pregnancy, can advise you on the pregnancy before it actually happens. And when it actually does happen, then they can actually guide you through it to ensure that there's a good outcome for both mom and baby.
It certainly sounds like us older women have a lot more to deal with, and it's almost like a miracle when you get through without any complications, I must say.
Yeah,
so
it does happen. It does.
Yeah, no, I know there's so much that can go wrong. It's actually, if you actually look at it, you'll actually probably feel overwhelmed, you know? So you have to sort of just focus on what's happening with you instead of looking at everything else.
Yes.
So a lot of, we briefly touched on a VBAC, so vaginal birth after C-section. A lot of people also try to opt for that, which is what I thought I might, you know, be able to, but obviously in my specific situation, I couldn't, and I'm fine with that as well. But obviously some people get pointed by that. What are the risks with doing that?
Okay, so first of all, just to clarify what a VBAC is. So it's a vaginal birth after a C-section. So this is basically when you've had a normal delivery, and now with the next pregnancy you want to try, you've had a C-section, and with the next pregnancy you want to try a normal birth. Yes. So it's the main risk associated with that is the risk of what we call uterine rupture. Okay, so if the understanding is when you have a C-section, we cut on the part of the uterus that we refer to as the lower segment. And this lower segment is the part that forms in the third trimester of pregnancy. And it's also the thinnest part of the uterus. So we cut there because it's easy access and we're able to deliver the baby without having to go through lots of uterine tissue to get the baby out. But now, when you cut over that area, it heals. But remember, the uterus is muscle. So when you fall pregnant again, the idea is you still get the distension of the uterus, the lower segment forms, and it thins out over that area where you have that scar. Yes. So now, when you're attempting a normal delivery after a C-section, remember with a normal delivery, there's contractions. You have contractions here, there, everywhere as far as the uterus is concerned. And now those contractions can even be over that area where the scar was previously had with the C-section. And when you have those contractions, it can cause that previous scar to essentially tear or rupture. Now, if that happens, it can have serious consequences for both mother and child. Because more often than not, when that happens, you're not even anywhere near a hospital setting because, you know, you are not expecting labor to start at that point in time. And then the main remedy is you have to get to a hospital as soon as possible. We have to do an emergency C-section. And even based on the extent of the rupture, it may even end up in a hysterectomy where you actually have to remove the uterus to actually save the mother's life. And also try and salvage or save the baby during that delivery as well. So it can be a very, very, very serious complication to have as a result of a VBAC gone wrong. But not to say that it's not possible. You do get women who have successful VBACs and nothing goes wrong. And I think the take-home message with that is I think you must get an OB-GYN who is supportive of your decision to have a VBAC. If you're talking about normal deliveries, you must actually have an OB-GYN who supports your birth option. Because you'll find that because of this increased risk, most OB-GYNs will tend to steer clear from a vaginal birth after a C-section and would opt to advise you to just have another C-section straight away. What I like to do is I like to sit my patients down and I like to be as honest as possible. Because I feel like the more you as a patient know, the easier it makes my job as a gynae. So I think communication is key from OB-GYN to patient, and also patient's expectations must be communicated to the gynae so that we basically on the same page. Because at the end of the day, we just want the same thing. We want a healthy baby, we want a healthy mother at the end of it all.
No, absolutely. Well, in my case, I was like, I'm not going to argue this one. It was just a question, like, for my side, from my personal experience. They said, well, there's a big risk that you could also lose your life. And I was like, no, that's fine. I'll have the baby injections. Okay. It's not worth the risk. It's not worth the risk. Yeah? For me personally, it was not worth the risk, especially at my age. You know what I'm saying? There's already enough stuff I can deal with. And like I said, I had other complications. So I had a very healthy pregnancy, mind you. Even in my second one where I said, you know, I had to have lumbar punctures because of the swelling in my brain. The neurologist wanted to put me on meds. I refused them because they weren't safe for the baby. And the baby came out perfectly fine. That baby's Tommee, by the way, my middle one. And I managed it through other more natural things. I went for cranial physio and all sorts of other stuff to just, you know, to keep myself in check. And actually it was really ultimately it took me quite some investigating through alternative ways as well, and a specialist, as well as my homeopath, through bloods and everything. And you know what it was ultimately? Body's a mysterious thing. It was actually mitochondrial burnout.
Oh, hectic. Sure.
Yeah. That's how hectic, and that's a story for another day altogether. But it was presenting itself. Yeah, it was presenting it. So for people who don't know what mitochondrial burnout is, basically like, as I say, correct me if I'm wrong, but basically it's like your blood cells have an engine in them, and my engine was basically burnt out. It's beyond adrenal fatigue and all the rest of it. So it was years and years of accumulated physical and mental stress, I guess, and that was presenting itself in the symptoms I was experiencing. But anyway, moving on.
It's rare, hey? Wow. Yeah.
It's women go through a lot to have a baby. Okay, they are very cute, don't get me wrong, and you get very broody and those feet and cheeks and everything else. Not a joke. You're creating a human being. So for all the new moms, especially, so for all, I see a lot of questions coming in, and I'm trying not to read them, but for all those new moms out there who are thinking, listen, I want this and I want that, and you know, can you, so obviously, yes, we've answered the question. You can have a natural birth after C-section, but there obviously are a lot of risks involved.
Yes.
What are the pros? I mean, just briefly, what are the pros and cons in general of having either one? So either natural
or C-section. Yeah. So the biggest benefit of a natural delivery is ultimately the what happens afterwards, the recovery thereof. So obviously with a natural delivery, it's a natural process and there's no surgical intervention involved. And as a result of that, you don't have any scar that you need to nurse afterwards. You'll find that many women complain that after a C-section, mobility is a bit hard, bonding with the baby is a bit hard, things don't come naturally as they would if they'd had a normal vaginal delivery. So the biggest benefit, I would say, of a natural delivery, the recovery, is it usually goes very smoothly. And women, they want to get back to things when they get back home, and they want to live their life as soon as possible. You don't want to spend the 2 to 4 to 6 weeks recovering from the surgery that would have been a C-section. Okay. The downside to a normal delivery, if anything at all, I guess it's the unpredictability of it all. You don't know when it's going to happen. You know, you don't know where you'll be. You don't know where your ob-gyn or your midwife will be to come and support you.
And being
and also the possibility of being in labor and eventually needing a C-section as a result thereof. Because what you need to understand is labor it's a process. It's a stressor on the mother and on the baby. And you don't know how you as a mother or the baby is going to react when that stressor is applied. So as a result of that, it leads to many unpredictabilities that could occur. So there could be things that go wrong with the mother, there could be things that go wrong with the baby. And if any of those things go wrong, a C-section becomes the way out. And that should actually be the primary reason why a C-section is performed, as a way out to a failed vaginal delivery. Whether it's failed because there's a problem with the baby or it failed because there's a problem with the mother. But that is ultimately why, we had, C-sections were actually came forth, because we found that there were many women who were actually having complications as a result of vaginal deliveries. We're having too many babies that were having issues post-delivery with from strenuous vaginal births. On the other side, the advantage of a C-section would be, to rescue a vaginal delivery gone wrong or an unsuccessful vaginal delivery. The other advantage of a C-section is the fact that, you can plan it. That on this day, at this time, at this place, you're going to meet your gynae and they're going to do a C-section and it's going to be okay. But obviously the downside to that would be the recovery and the afterwards, the postpartum period with a C-section, as opposed to a normal delivery. So they kind of balance each other out as far as pros and cons are concerned.
So I guess you have to look at your own personal situation and see what works best for you and your family and your expectations of your birth.
Yes, but I think the other thing we need to also consider is what your healthcare worker has to contribute to it. So when you're
Yeah.
deciding on a birth plan, particularly if you're not a first-time mom, your previous birth history comes into play. How did you deliver your previous birth, your baby? Did anything go wrong? Why did it go wrong? And what can we do this time differently to avert or to prevent whatever went wrong from going wrong again? So the previous birth history always has a say. And then when it comes to the end of the journey, the third trimester, when it's time to prepare for delivery, we look at things like the position of the baby, we look at the size of the baby, we look at things like the placenta, the position, those kind of things, the amniotic fluid, all the things that would that would point towards a baby that is comfortable and can probably undergo a normal delivery, or a baby that's in distress because of whether it's blood pressure, whether it's gestational diabetes, or whether it's whatever it may be that necessitates delivery by a C-section. But it has to be a decision made in conjunction with your healthcare worker, be it a midwife or be it an OB-GYN.
And tell me, is there a limit? Because there's always I don't know if it's a myth or not, but is there a limit as to how many C-sections you can have?
The general rule of thumb is 3 C-sections. But the rationale for that is that, obviously, like I said, you're cutting essentially over the same area every time you do a C-section. And with that, you get a buildup of scar. In addition to that, you get a change in anatomy as well. Because every time you have scar tissue, you get, organs are being pulled in different areas where they wouldn't normally be. For example, if someone never had a C-section before. So with that, every time, the more C-sections you do, there's a higher risk of complications. And these complications include injury to bladder, injury to the bowel, and other things. So it just increases your risk of having these complications. And also with the thinning of the lower segment, if by any chance you end up having a contraction prematurely, there's a higher risk of that lower segment rupturing with the more C-sections you've actually had. So because of these risks, we always say, maybe with 3 C-sections, we should cut it, because at the end, these risks, they add up the more C-sections you have. But I mean, I had a patient who had 3 C-sections, but unfortunately, all those babies unfortunately didn't make it. And then she came to me, and now this was the 4th time she was going to have a C-section. And then we had no choice. No. We had to do a C-section for her, and luckily it went well. But this should be more the exception than it is the rule. Because of course. If things go wrong, it can be very, very severe for both mom and baby.
No, absolutely. I see a lot of questions coming in. Oh my goodness! And you know what the funny thing is? Murphy's Law. My light stand was fine all week, but today it broke, so it actually shakes if I move it. So I'm trying not to touch my phone screen that much, but I really want to get to some of these questions. I know we already had a pre-existing question from one of the Tommee Tippee ZA followers, and she was asking about other postpartum effects of having the hormones all over the place after giving birth. I don't know if we can touch on those now, or would you rather go straight into questions?
So you're talking about the effects of postpartum in?
Like things like all this, like there's preggy acne, which I also suffered from. There's pigmentation and all the things that are part and parcel, some of us, as part of the pregnancy. Is there a reason for that? People always say, oh, you should be glowing in pregnancy. I always have, even now you can see I've got some breastfeeds happening because I'm still breastfeeding. In fact, when I breastfeed, it's even worse. I literally get volcanoes, like I call them,
So look, the idea with all of those is that pregnancy is something that it's a state that is hormonally controlled, particularly in the first trimester and also in the second trimester. But first trimester primarily because you have the hormone, the HCG, which forms. And that basically what controls the majority of the first trimester. Also, in addition, with a bit of progesterone as well, that also supports and keeps the uterus nice and closed and from contracting. But primarily, the HCG is the reason why you'll find most women have the morning sickness, the nausea, the vomiting, the intolerance to certain foods, etc. Then you get to the second trimester, and then suddenly now you have the placenta, which is formed. And then the placenta also starts producing its own hormones. And then you realize that the estrogen and progesterone and also the HCG that's also further produced by the placenta have also got their own side effects. Okay. But for most women, those side effects are actually more positive, like on the skin. That's why you find most women are glowing, because those hormones actually have positive effects on the skin, and then you'll find, oh, you're glowing in the second trimester because the placenta has kicked in and is now producing those hormones in abundance, and you're glowing as a result of the side effect, of the effect of those hormones. And then and then you get pigmentation, you get acne in some cases if it's not if your body reacts adversely to those hormones. But if it reacts positively, then you actually find that you have that pregnancy glow that we commonly speak of. Well, for some.
I see a lot of comments saying, "Oh, I got hectic preggy acne as well." Listen, I've done it 3 times, gone through it 3 times. Nothing changed, okay? Different baby, same problem. But it's fine.
It's just the way different. Remember, it's like the contraceptive pill. If you take a contraceptive pill and the next woman takes a contraceptive pill, the effects on you are going to be completely different. But it's exactly the same hormones. It's just the way your body chooses to react to it. That's that's going to determine whether you glow or whether you actually get acne from it.
Yeah. Well, listen, I'm done with that. So I'm going to start glowing now, and that's what I'm going to do now. I'm going to glow, okay, after the pregnancies and after I'm done with breastfeeding. I see a lot of questions. I think we really need to get onto these now. I saw a couple about tearing in natural birth and stitching. I'm not sure what they were. I'm going to try my best to take this camera too much, okay, because like I said, my stand is really wobbly. Let me go back up. There's been so many questions. I don't think we'll be able to get through all of them. But just for anyone to ask. Yes. Before we carry on, I just want to let everybody know, Dr. Kofi will answer some in the comment section, and you can also follow Gynae Works, and he will be able to engage with you on some of these. Just remember, he is a doctor, he does have patients, so he can't get back to you like right now necessarily. Okay. You might have to do your own live actually and just answer these. We can screenshot you all the questions, and you might have to do like a Q&A like where you're just answering all the questions. I think that might be a very helpful session. Someone said your delivery recommendations for breech position, baby.
Ooh, in this modern day and age, I would say C-section. The thing about breech deliveries is, remember, the idea is there's a saying that says wherever your head can fit, your body can fit. I don't know if it goes like that, but something along those lines. So, yes,
the baby does.
You can manipulate your body, but it's very hard, to manipulate your head. So the idea with the breech delivery is you deliver the legs first, you deliver the body, and then there's a chance that the head could get stuck. And that's a chance that many gynaes and midwives and healthcare workers are not willing to take. Because in that state, at that moment, there's panic, there's rush. You want to do everything to get the head out. And to avoid that, many healthcare professionals will say, rather just go for a C-section altogether. I would honestly also that I would definitely recommend that. It's not worth it if you ask me.
No, definitely not. You don't want brain damage or anything either. And then someone asked how do you prevent tearing?
You have a C-section.
Do you mind if I answer that one? And I'm not a professional, please don't quote me, but from my first pregnancy, I remember with my wife, there is what do you call it? It's almost like perennial stretching. You literally have to over time try and stretch the opening, I suppose you would call it. I don't want to be too graphic here, but you use your fingers to stretch it, like with anything. Like if you keep pulling at something, right, it will stretch. So I mean, look, I don't know, I don't know how well that works or not, but you're welcome to explore that for the mom or the mom to be who asked that. I'm trying to see what else is there.
Quickly, the idea with tearing is it's a very unpredictable thing in normal delivery because it happens that split second where the head comes out. We do our best to support the perineum, which is basically the muscle surrounding that vaginal area, that moment when the baby is coming out. Even that cannot guarantee that you will not tear. It's only at that split second that either tearing happens or that support that we give the perineum actually helps to prevent tearing. And as when I was mentioning C-section before, and the reason why people want C-sections, I actually get a number of my patients coming to me and saying, "Doc, I want a C-section because I don't want anything to go on down there as far as tearing is concerned." And people are actually requesting.
But you can have stitches though. Most of most people get stitches though, right? So I don't, yeah, I
Yes,
mean,
yes. So once you tape, we do stitch it and we try to get it back to as normal the anatomy as it was before it actually tore.
yeah.
But obviously with that now it means you'll have to care for the stitches and the wound thereafter,
But that,
postpartum.
but that can't be any less painful. That can't be any more painful than a C-section, surely, though, because
Probably
that's
the
much
same.
less in terms of caring and stitching.
Yes, definitely. I mean, look, the two do not compare because I mean, a C-section it's an abdominal procedure. We go through
Major.
many layers. It's two different war games altogether. Okay. Yes.
Someone asked, does a vagina go back to normal? As in, once you, I guess what she's trying to say is after you've had a baby naturally, does everything down there just shrink back to normal? I suppose would be the right way to ask.
It shrinks back to normal, but not normal. Because the idea,
Okay. And at the end of
the
the
idea
day,
is, look,
right? So nothing is normal anymore. You've had another human. So yeah, it would
no, because you've
likely.
delivered, there's elasticity of the muscles have stretched over time,
Yeah.
they do get exercises and all of that, but never to the way it was pre-delivery.
Okay.
Yeah.
Someone asked that, doctor, does the book cover on how to take care of your mental health after delivery? It's a very important question,
That
especially
is very
these
important.
days.
Yes, and I think it's a question that is quite, I must admit, a bit neglected, if you would, as far as in a clinical setting is concerned, because most doctors would be involved with the pregnancy, the delivery, and then afterwards, the newborn mom or the first time mom is left to deal with a new baby, managing a
Yeah.
household, still managing a marriage or a relationship, and that can get to a lot of people. That can really get to a lot of people. So the idea is the book does have a chapter on postpartum, mainly dealing with these issues and knowing that women have a lot to deal with after delivery. And I think that's not something that their partners are necessarily cognizant of. You hear the term superwoman, and women feel the pressure to live up to that term. But after going through a pregnancy, after going through a pregnancy and a 24 to 48-hour labor, and eventually ending up with a C-section, and then having this baby who fully and so depends on you, and then breastfeeding not going well, and then your partner not understanding what you're going through, and then you get home and you have to manage a household, and then, for example, you have a toddler in the house also demanding your attention. Thinking about it as a man, I get overwhelmed, and I'm a man.
I'm very tired listening to that. I'm over the first part of it.
So look, it's a topic that needs serious attention, and that's the reason why I actually allocated a whole chapter to it in the book. But I know we need to do more than just allocate chapters in books to it. It's something that needs to be spoken about. It's something that needs to be put out there so that women know that it is okay to feel overwhelmed. It is okay to ask for help. It is okay to ask for points of references where you can actually seek help when these things happen. And I always try to keep in touch with my patients afterwards to say, listen, how's it going? Are you coping? Any issues? That kind of stuff. But it does become hard to do it for every single patient. But we do it. Yeah.
Well, perhaps a referral is in that case a better option, because obviously you don't have the capacity to be a therapist to all your patients. You know what I'm saying? So
yes,
I mean, that's a whole different ballgame. And maybe that's a new topic for another book, right?
Definitely.
Another question says, what happens in a case where placenta is short, and what is the cause? Can you have natural birth then with a short placenta?
Wondering what she means by a short placenta.
Isn't it that where I've heard this before, like where they have to go for stitches to make sure the cervix doesn't open or something similar along those lines? Because it's,
No.
I don't know why that is.
That's cervical incompetence. That's something completely different.
I'm
If you're
not sure.
talking placenta, there's basically two things that can go wrong with the placenta in pregnancy. The first thing is when the pregnancy forms, the placenta can implant in an area where it's not favorable. And that area is usually when it covers the mouth of the womb. It's a condition we call placenta previa. It's a condition where you can't have a normal delivery with that. You may be prone to intermittent episodes of vaginal bleeding throughout the pregnancy, to the point where such a vagina may actually necessitate premature delivery. And it it's basically an obstetric. It's an obstetric emergency, and already it classifies your pregnancy as high risk if we as a placenta previa. The other thing that can go wrong with the placenta is what we call an abruptio placenta. That's where the placenta detaches prematurely from the uterine wall before it's time for labor. And the things that can commonly cause that is high blood pressure, preeclampsia, and also if you have any form of abdominal trauma directly to your tummy, it can also cause the placenta to separate. But ideally, the natural position for a placenta is either anteriorly or posteriorly. But if it lies low or more cervical, then it's a bit of an issue as far as, first of all, delivering that normally is concerned, and also placenta previa with intermittent bleeds throughout the pregnancy. Okay.
That was a very informative answer for me as well, even though I'm not having any more babies, but yeah. There's another question saying, if a C-section was due to failed induction, can a person still give birth naturally afterwards? I guess it's the same, really.
Yes. So what happens with a normal, in induction is there's a number of things that can cause it to fail. It can fail because the mother is tired, maternal exhaustion. It can fail because the baby is tired, fetal distress. Or it can fail because the progress isn't adequate for what we expect for how long you've been in labor for. Meaning the baby's just not descending, whether you're having strong contractions or not. So depending on what the reason for the failed induction is, it may be something that may not necessarily repeat itself in the next pregnancy. For example, fetal distress. It's not necessary to say that if you have fetal distress now, your next baby will also be distressed when you're in labor. There's no correlation with those. For example, or if you had maternal exhaustion, there's no saying that with the next pregnancy you're going to be exhausted and therefore you end up with a C-section. So I think you have to take each pregnancy on its own merit. Like what's going on in this pregnancy? What in this pregnancy necessitates me having a C-section, or what in this pregnancy necessitates me trying for a normal delivery? So I think it's always good to just take each pregnancy on merit, but you can always draw a bit of know-how from what happened in the previous pregnancy.
Okay. I'm not sure what this question means. It says, is postpartum delivery hereditary? I'm not sure what they mean by
I think what she means is if you went through labor and you suffered from postpartum, would your children also suffer from postpartum?
Okay.
And I think that would be no. I think we all have our own stresses. We all have things that stress us. So it's not necessarily to say that if you had postpartum in your pregnancy that your children will suffer the same thing when they go through a labor process. So I think it's each on its own merits.
Yeah, I'm just scrolling now to a few more. Someone asked, you only work at Fourways or elsewhere?
Yes. Only in Fourways Life Hospital.
This is quite a serious question. Do we have cases where people die while doing C-section?
Yes. So remember this, the idea with the C-section is, if I can elaborate further on this, the idea with the C-section is it's a surgical procedure. So with any surgery, there's risk of complications. And ultimately, the worst complication that can happen from any surgery is death. Okay. Obviously, we put measures in place to prevent this from happening. Okay. Sometimes it's even the measures are not enough. Okay. So the idea is that's why before a C-section, we have to get consent. We have to counsel the mother to say, listen, this is the reason why we're doing a C-section for you and your baby. And doing the C-section means you could suffer from bleeding. You could have anesthetic complications as far as the spinal is concerned. You could have postpartum hemorrhage, which is bleeding after you've delivered after the C-section. You could have infection of your wound, which can also get quite severe. You may need a hysterectomy to save your life as a result of a C-section that didn't go as planned. So all of these things can eventually culminate in you actually having an unsuccessful C-section and ultimately death. Obviously, this is not something that people like to talk about because we're all positive and it's positivity, but when we're consenting for a C-section, we have to tell people, all of these things so that you are aware that this is what could potentially happen. And to touch on that further, that's why it's important to do C-sections for the right reason. Because if you're doing C-sections unnecessarily, and God forbid something like that happens, it's very hard to defend. So
Yeah.
why would you do that if there was no fetal distress, if there was no maternal exhaustion, if there was no poor progress of labor, if there was no real indication other than, oh, the doctor felt like it, then it becomes a bit tricky, and
Yeah.
you could land yourself in hot water. So personally, I think it's best to avoid C-sections where you can and use them when it is indicated. But like I said, there's lots of people who these days would request a C-section, and that in itself is fine because you've got the consent that you would require to perform such an operation.
Well, I'm obviously still alive, but in my second one, you know, because they give you these drips. No, it's actually a bit scary. My husband had a bit of a Grey's Anatomy moment there with our second one, because I was talking to everybody just before they were about to cut, and I just literally passed because I suffer from low blood pressure, and you know, it's early in the morning. It was winter. You're not allowed to eat for how many hours before they put all these drips. And I think between low blood sugar, low blood pressure, and everything else, I literally just flatlined. I didn't know. So I thought I was about to faint, and I've never fainted. So I just felt like, okay, something's happening. I can't hear properly. My ears, it's like, you know, like when you're in the bath, you can hear properly underwater. I felt like my chest was heavy, and I was like, it's like someone's sitting on my chest. And I was telling them this. I'm thinking I'm about to pass out. That was me coming too. I had passed. Remember the past? No, it's not like now. I still can't believe it, and I was like, "What happened? Like, where did I go? I don't understand. I cannot like the part of me passing out. Me thinking I'm going to pass out was actually me now finally becoming, you know, coming to getting awake again. So it was really like quite a scary moment, and I think my husband was in shock, seriously, and then. I just remember the nurses and the Magani saying, "Oh yeah, okay, you'll be fine, don't worry." And then eventually my ears cleared up and I started feeling better, you know. But you can imagine now my last one now, the third one, which I just had 7 months ago. I was like, phew, I had to like really calm myself and say, "Okay, this is gonna be fine, fine." You know, it's a lot.
It's hectic. Look, we forget that a C-section it's an operation, and for, like for first-time moms, some moms have never been to hospital, let alone to an operation, to a theater for a whole surgery. So I think we take for granted what a big deal it is to actually go for an operation. Even though you know some people, it's C-section, you're delivering a baby, you're gonna be fine, but it's a huge step for most people.
It's actually, if you can do natural, please. Okay, it's just much quicker. Well, actually not quicker. It's much easier. Sorry. Not quicker necessarily. For some people it is quick though, like 2-3 hours and the baby's out, you know what I'm saying? Okay. There's another question. If a woman has fibroids, which option is safe for delivery?
Ooh, it's tricky because the idea with fibroids is it's always based on the size of the fibroids and also the location of the fibroids. Remember, when you go into labor, the idea is that you're going to have contractions, assuming you're attempting a normal delivery. You're going to have contractions, and contractions are literally all over the uterus to try to facilitate delivery of the baby. Now, when you have fibroids, particularly extensive fibroids, those contractions are very limited. The effects are also very limited. So as a result of that, it makes a normal delivery very difficult as far as delivering normally with fibroids are concerned. But this will depend on the extent of the fibroids. Are they mini? Are they big? The position of the fibroids. And this is something that your OB-GYN will probably be able to guide you and let you know what would probably be best. But it's to say that both options are possible, but it's relative to how many, where the fibroids are located, etc.
Okay, we're going to have to wrap it up soon, but just to get a few more in there, this is a different, interesting one. How long C-section can I have a tummy tuck or liposuction?
Oh.
Coming.
Well, yeah, that is interesting.
I don't know if you can really answer that.
Yeah, I think a plastic surgeon might have better input, but I think you'd need to ideally recover from your C-section.
Fully.
Give it a good 6 to 12 months, and then maybe consult with a plastic surgeon to give an opinion. I'd say probably have that consult at the 6-month mark, and then plan it thereafter with a plastic surgeon to get it done. But you need to recover from the one up first, I would say.
Yeah, that's all major surgery again, hey?
Yeah.
Trying to see if there are any other questions. what is the name of your book and where can we get it? So the name of the book, as we've been saying, is pregnancy related, but Dr. Kofi can tell you where you can get it.
Yes, so it's pregnancy related, a woman's health centered narrative. If you're looking for a copy, basically we've got a page called the Related Series, at the Related Series on Instagram. On the GynaWorks page as well, we've got a link there which leads you to the website where you can ultimately order a copy. So you can either order a copy directly from the GynaWorks page on Instagram, or via our website, or via the Related Series page, and we'll deliver it to you.
Okay.
And it's written purposefully for pregnant women. Okay.
Yes. But, 3 people who are still online at the end of this, which will be in a few minutes, will actually stand a chance to win this book anyway. So Tommee Tippee ZA will choose the winners based on interactions and everything, and they will post it in the comment section once this video has been posted. Let me see. Hi, I'm 19 weeks pregnant and my baby's sitting low in breech. I'm now having pains when walking and driving. Will this ever get better or worse? Oh, well.
It'll get better. It'll get better, because the idea was at 19 weeks is that there's still plenty of space for baby to turn around and more favorable positions for you to get that pressure. But what you can also do for yourself is also avoid standing for standing for long periods, sitting for long periods, and basically finding a good balance. Just to alleviate and make you a bit more comfortable. But I wouldn't say you should worry too much about the breech, because it's very early days and there's still plenty of time for baby to ultimately change positions.
Someone said, Doctor, you didn't cover, for those of us who are still trying to conceive. I mean, that's quite an extensive topic though, isn't
it? That's a whole book.
Wow.
But I can touch on it briefly if you want.
Yes. Okay.
Okay, so when you're trying to conceive, there's a number of things you have to make sure of. Okay, so ideally this should be done in conjunction with a gynae, with a gynecologist, and not necessarily an obstetrician. So as a woman, the first thing that you need to ensure is that you have regular periods. Generally, if you have regular periods, like clockwork, once a month, more or less when it's supposed to happen, for more or less the same amount of days, it's a good sign that your hormones are actually in a good place and they're nicely balanced. Because this will then easily facilitate pregnancy, in the sense that it probably tells me that you're ovulating, and it makes it easier for you to conceive. So the idea with that is then you see a gynecologist, they do an assessment, they check to see if there's any existing conditions that could hamper you from actually trying to conceive, for example, like fibroids or ovarian cysts or endometriosis or polycystic ovaries, and then they manage that with you. Because remember, for most of these conditions, it's not a sentence to say you can never fall pregnant. It's just to say you've got this condition, we can manage it so that you can get pregnant, or we can manage it so that the pains can get better, or we can manage it so that the bleeding can get better. So there's always a remedy for these conditions, and we can manage it so that you can get pregnant if that is what's desired. But it's always good to seek counsel before you actually attempt to get pregnant. Then the gynecologist can guide you and say, listen, let's optimize this, let's do this first. And when you do get pregnant, these are the things that we're going to need to look out for, so that you're also prepared and you're part of the whole process. And then it just makes it easier. It really does. So I would say, look, if you want to fall pregnant, I think schedule a visit, have a chat with the gynae, discuss your concerns, discuss your fears, discuss your worries, discuss the reasons why you think you may not be conceiving, and then take it from there. But there's always a solution. That much I can say.
I am definitely living testament to that. I generally didn't produce enough progesterone. So I was taking bioidentical progesterone cream that you sort of put on your forearm or the inner forearm, like that. I had one instance where, although I'm not diabetic, I'm not terribly anything in particular, but the way my body was insulin and all the rest of it, sugar and insulin, I had to take glucophage for 3 months, but a very, very low dose. I think the lowest dose you could take. So there's very things that I also had to go through. And then I had perfectly normal pregnancies thereafter. I didn't have to do any fertility or anything like that. But, like everybody's situation is different. You go through seasons in your life, health issues, age, whatever it is. So it's quite a lot. We have many questions pouring in. Unfortunately, we've really run out of time, and there's my baby, but my husband the rescue. She might make an appearance if he doesn't succeed. So, we've been on for nearly an hour, and
Yeah.
I'm still seeing lots and lots and lots of questions coming through. I'm really sorry, everybody, but we have to cut it short here. I do think that Kofi needs to have his own live on Gynae Works, and I definitely know that the Tommee Tippee team will give him all these questions, and maybe over the next coming days, weeks, he can address each of them, or at least the most urgent ones, and you should have some sort of answers. But thank you so much for your time. Thank you so much for sharing that knowledge with us. There was a lot to learn. There's a lot more I know. But you know, this is just it was supposed to be 30 minutes and we're now on 55 minutes, and I don't want to push it too far. Thank you to everybody who joined the Ready to Pop series this week. Thank you to Tommee Tippee Zade for hosting this amazing week in celebration of Pregnancy Week. I'm feeling very honored and privileged to have been your host for the series, and I hope that I can see you on these pages again. To all our guest speakers and everybody who's asked questions and who's been engaging with us, and obviously to all our winners, congratulations again. There will be details again as to how you can order the book if you did not get to win yourself a copy. But again, Dr. Kofi, it was a pleasure, and I hope you have a good evening. So this is it from me. Goodbye and good night.
Thank you so much.
Oh,
Cheers.
wait. We do have
there we are.
Hello.
Look.
Hello. What did Daddy do? Did Daddy just bring you here? Look at his face.
I'll be the cutest.
What's this? This is Jody. Jody is 7 months now, and she's transitioned to solids, and she's a little chunky up there, and I eat face. And she's supposed to be sleeping.
So adorable.
Bye, you.
Cheers. Oh, wow. That's so cute. Cheers. Bye. Thank you.
Thank you so much. Bye. Oh, that was cute, baby. Thank you. Only knew. You said smile and she smiled. Here, take her. I need to share it and put a caption.
Okay. Let's take some biscuit.